This cream is used on the skin to relieve itching and pain from certain skin conditions, such as scrapes, minor burns, eczema, and insect bites. It can also treat minor discomfort and itching caused by hemorrhoids and certain other problems of the genital/anal area, like anal fissures and itching around the vagina/rectum. In addition, some forms of this cream are used to decrease discomfort or pain during certain medical procedures/exams, such as sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, is a local anesthetic that works by causing temporary numbness or loss of feeling in the skin and mucous membranes. When using Xolido XP cream, it's important to follow the directions on the package if you are using it without a prescription. If your doctor has prescribed this medication, be sure to use it as directed. Before applying the cream to the affected area, be sure to clean and dry the skin as directed. Apply a thin layer of the cream to the affected area, usually 2 to 3 times a day or as directed by your healthcare provider. If you are using the spray, be sure to shake the canister well before using. Hold the canister 3 to 5 inches from the affected area and spray until wet. If using on the face, spray the medication onto your hand and apply to the face. Avoid spraying near your eyes, nose, or mouth. For the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. It's important to not use the cream on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor, as this may increase the risk of serious side effects. After using the cream, be sure to wash your hands immediately unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or ears. If the medication does come into contact with these areas, rinse with clean water immediately. The dosage of Xolido XP cream is based on your medical condition and how you respond to treatment. Do not use more of the product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, be sure to consult your doctor before using this medication. If your condition does not improve or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you experience temporary redness, stinging, or swelling after applying Xolido XP cream, let your doctor know. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Most people do not experience serious side effects, but seek medical attention immediately if you have difficulty breathing, seizures, or a severe allergic reaction such as a new rash or swelling. If you notice any other effects, consult your doctor or pharmacist. There are specific reporting procedures for side effects in the US and Canada, so be sure to follow those guidelines. Before using Xolido XP cream, it's important to discuss any allergies you may have with your doctor or pharmacist. This cream may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have broken skin or an infection in the area where the cream will be used, or if you have heart disease, liver disease, or a certain blood disorder called methemoglobinemia. If you have an MRI test scheduled, make sure to let the testing personnel know that you are using Xolido XP cream, as some brands of this cream may contain metals that can cause serious burns during an MRI. Before undergoing any surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that children may be more sensitive to the side effects of this cream, so it's best to use it with caution. If you are pregnant, this cream should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. And if you are breastfeeding, while this cream may pass into breast milk, it is unlikely to harm a nursing infant. However, it's always best to consult your doctor before using this cream while breastfeeding. When using Xolido XP cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help ensure the safe and effective use of Xolido XP cream. If this cream is inhaled or swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, they should call 911 or their local poison control center immediately. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. It's important to use Xolido XP cream regularly and attend all your medical appointments and lab tests as scheduled by your healthcare provider to monitor your progress and ensure the medication is working effectively for you. If you use Xolido XP cream regularly and happen to miss a dose, simply use it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and continue with your regular schedule. Avoid doubling the dose to catch up. It's important to stick to the recommended dosage and timing for the best results. When using Xolido XP cream, it is important to store it at room temperature and avoid freezing. Be sure to keep it out of reach of children and pets. Also, make sure not to store the gel, foam, or spray canisters near high heat or open flame, as they are pressurized containers. When disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.